I'm Dr. Jenny Andrus. I'm a pain management physician at Orthopaedic and Spine Center, and I wanted to go over some of the side effects and risks associated with using opiate pain medicines. So oftentimes people say this as narcotics, but I'm going to refer to it as opiate pain medications because that's specifically we're talking about the class of medications like morphine, oxycodone, and fentanyl. Now, these medications can be very useful and are used regularly by physicians throughout the country to treat both acute pain and chronic pain. But just like every medicine, they come with risks and they come with side effects, and those things need to be balanced to determine whether it's appropriate for someone to stay on them. The biggest risk with the opiate pain medications is respiratory depression, or a decrease in the amount of breathing that you have. So these medicines always need to be taken as prescribed and titrated slowly. Okay, so oftentimes the physician will say start low and go slow. Okay, so especially the long-acting medicines have to be started at lower doses and then slowly increased to make sure that you tolerate them. Now, besides that, the more common things that people are worried about are constipation and abdominal pain. So these things make you nauseous and they make your bowels move very slowly. We can usually avoid that by making sure that we're getting lots of fiber and fluids, and we can use things like stool softeners, but it's important if you're ever going to take these medications routinely that you're watching your bowels. You don't want to be having bowel movements infrequently, and we like to see at least every other day while you're on these medicines. Now, some of the newer side effects or concerns are things that we've noticed over the past several years as these medications have been used more frequently are things like worsening of mood or depression and some of the endocrine and hormonal changes that can happen as a result of being on these medications long term. Other issues are addiction and physical dependence or tolerance. Now, physical dependence is not the same thing as addiction. All right? Physical dependence means that if you abruptly stop the medicines when you've been on a higher dose for a long period of time, you may have withdrawal. Now, withdrawal from the opiate pain medicines isn't deadly, but it hurts. It feels like you have the flu, and so the medicines need to be titrated down. Being physically dependent on a medicine does not mean you're addicted to the medicine. The same thing would happen in medicines like gabapentin or in antidepressants. They need to be titrated off. So it doesn't mean you're an addict. Now, addiction is a risk, though, with these medicines, and that risk is higher in folks who have a personal or family history of addiction. And addiction is a behavioral thing. It's that you're unable to stop craving the medicine or taking it in a way that's not prescribed or a way that causes harm to you. That risk is low, but it does exist and it needs to be discussed with your physician. The tolerance portion of it means that though you need more and more of the medicine to get the same effect. Unfortunately, at times you can't bypass the tolerance to get better pain control. So always increasing the dose of the medicine is not always the most appropriate thing in terms of treating pain, particularly chronic pain. So whenever someone's on these medications, all those risks have to be carefully balanced with the benefit that they're getting, and we always recommend you use the lowest dose to get the most benefit.